Hello and welcome to my channel. Today we are going to discuss about the Babinski reflex, its pathway, how to elicit the reflex, its components, and the clinical significance. I have linked a useful article below in the description, so please do check them out. Let's begin. Babinski reflex is also known as the plantar reflex. This means you elicit this reflex on the foot. The reflex is named such because of the neurologist Joseph Babinski. Since that time, it has been incorporated into the standard neurological examination. The Babinski reflex is easy to elicit without sophisticated equipment. Also, it requires little active patient participation, so it can be performed in patients who are otherwise unable to cooperate with the neurological exam. Now let us study the pathway. This is very important for medical students and is a common question asked in both written exam and in viva, so pay attention. But first, why you want to test Babinski reflex? The Babinski reflex tests the integrity of the corticospinal tract. You can watch the corticospinal video that I have linked above and in the description below to get better understanding on how the tract descends. But, in this video, I will give you a quick overview about the corticospinal tract. The corticospinal tract or CST is a descending fiber tract that originates from the cerebral cortex through the brainstem and spinal cord. These fibers from the CST synapse with the alpha motor neuron in the spinal cord and help direct motor function. You must remember that the CST is considered the upper motor neuron, and the alpha motor neuron is considered the lower motor neuron. So, the key important is any damage along the CST can result in the presence of a Babinski sign. Now, let us understand the normal response. First, you stimulate the lateral plantar aspect of the foot. This lateral plantar aspect of the foot represents the S1 dermatome. This stimulation normally leads to plantar flexion of the toes because of the stimulation of the S1 myotome. Why this thing happens? This happens because, when the nociceptive fibers in the S1 dermatome detect the stimulation, the nociceptive input travels up the tibial and sciatic nerve to the S1 region of the spine and synapses with anterior horn cells in the spinal cord. The anterior horn cell carry the impulse to the primary motor cortex via the corticospinal tract. The motor response which leads to the plantar flexion is also mediated through the S1 root and tibial nerve. This results in the toes curled down and inward. Sometimes there is no response to stimulation. This is called a neutral response. This response does not rule out pathology. Normally, the descending fibers of the CST keep the ascending sensory stimulation from spreading to other nerve roots. But when there is damage to the CST, nociceptive input spreads beyond S1 anterior horn cells. Remember, the key word is spreads. This leads to the L4 and L5 anterior horn cells firing, which results in the contraction of toe extensors via the deep peroneal nerve. Comment down below what are the toe extensors. Next, we will look at the components of the Babinski sign. I was asked this question during my internal medicine exam. As discussed, the Babinski sign occurs when stimulation of the lateral plantar aspect of the foot. The first component of Babinski sign is the extension of the big toe. The second component involves the fanning of the other toes. This suggests that there has been spread of the sensory input beyond the S1 myotome to L4 and L5. An intact CST prevents such spread. My lecturer will stress that the third component is the contraction of the tensor fascia lata of the thigh. It is crucial to remember the components because sometimes it is asked in viva. When I was asked the question, I did not mention the third point, so I lost few points there. In infants, the CST is not fully myelinated, so the presence of a Babinski sign in the absence of other neurological deficits is considered normal up to 24 months of age. Next, we will try to understand the clinical significance of a positive Babinski sign. As mentioned previously, the Babinski reflex is done as part of the routine neurological exam and is utilized to determine the integrity of the CST. The examiner watches for dorsiflexion or the upward movement of the big toe and fanning of the other toes. When this occurs, then the Babinski reflex is present. If the toes deviate downward, then the reflex is absent. If there is no movement, then this is considered a neutral response and has no clinical significance. The presence of the Babinski reflex is indicative of dysfunction of the CST. Oftentimes, the presence of the reflex is the first indication of spinal cord injury after acute trauma. The summary of this video are: Babinski reflex is also known as the plantar reflex. Any damage along the CST can result in the presence of a positive Babinski sign. The stimulation of the lateral plantar aspect of the foot leads to plantar flexion of the toes because of the stimulation of the S1 myotome. The motor response leads to the toes curl down and inward. The first component of Babinski sign is the extension of the big toe. The second component involves the fanning of the other toes. The third component is the contraction of the tensor fascia lata of the thigh. In infants, the CST is not fully myelinated, so the presence of a Babinski sign in the absence of other neurological deficits is considered normal up to 24 months of age. The presence of the Babinski reflex is indicative of dysfunction of the CST. Oftentimes, the presence of the reflex is the first indication of spinal cord injury after acute trauma. That's all for this video. As usual, please give thumbs up, comment and subscribe if you find this video useful, as this will motivate me into doing more videos like this. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.